Well, I think science is moving all the time. That's part of the problem. It's a very expensive process. People are living longer, so that brings in new forms of disease and multi-morbidity. You don't just live with one problem, you have many of them. In cancer, as in anywhere else, but particularly in cancer, we're looking forward with hope to the whole process of personalized medicine. And the genetic testing, so that we can make sure that the treatment fits the individual or the group of individuals. And that way, you won't waste resources treating people unnecessarily or potentially harmfully, and you will focus on the drug or the treatment and the individual and get the best out of the system. And I think that's where we're moving. But it's taking time to both produce those drugs, but also to develop the genetic testing.
Probably are many reasons. One of them is, of course, what we discussed earlier on, that, okay, we do not have the money. But then, of course, you have the money when you have to use it later on. Then there's, of course, that kind of a new awareness of understanding of safeguarding people's health, not only treating the illnesses and trying to prevent people dying on acute issues. But third, I dare say, is that we do not have that kind of yet effective cross-border patient organizations, and the member states tend to keep it on national policies, and they tend to be very hesitant or outright negative towards European regulation, pan-European cross-border healthcare, or any regulation, for example, about screening.
Urgency. Well, I think that for a long time the matter of healthcare has been treated as a matter of cost by finance ministers and not by health ministers. And I think that whenever we think about how we should reshape our health systems, the involvement of scientists, patients, researchers, all these stakeholders have to come together. This sometimes takes a long time, but in the end you get much better policy, which is not only cost, but also focused on the future.
I think that first of all we should recognize the efforts of the European Commission in terms of prevention, and have in mind now the guidelines for the cervical cancer, breast cancer and colorectal cancer. However, what I do really believe is that although the Commission is doing a lot and has good initiatives, it has limited power and limited competencies. And I really think that member states should step up in terms of political commitment. So I really think it's also now up to the level of the member states.
Prevention is a known event in a sense, because when you prevent something, something doesn't happen, so it doesn't make the headlines. So sometimes politicians are not very much convinced of these issues because they want to have an immediate return in terms of popularity, in terms of achievements or results and so on and so forth after the investment in prevention.
Well, I think there isn't one area, but there is the whole area. What we've seen in successful approaches to cancer is the need to have a plan, to have a structured approach to addressing cancer, which is why we've worked with the member states as part of the European Partnership Against Cancer on the development of national cancer plans. And these national cancer plans, they usually cover the whole range from prevention, from health promotion and prevention, to management and care, all the way to caring for survivors, for palliative care if necessary, and so on. And it's that coordinated approach which is actually, I think, behind a lot of the improvements we've seen in cancer care for the last few years. Well, I wouldn't, as a Commission official, highlight a particular country. I don't think that's really the way we should be in this debate. But I think we have an agreement that where we have these comprehensive plans in place, where you have a situation where there is an understanding that everything is important, that prevention is important, that a quality assured early detection and screening is important, that the management is important, that there is evaluation, that there are mechanisms to correct within the system, that there you have good outcomes. And I think it is difficult to say there is a country, but there are regions who are doing this quite well, and there are certain healthcare providers who are doing this quite well. And I think you can see that in the data which we have now on cancer mortality over the European Union.
You know that patients are demanding, of course, fast access to new medicines. They want safety, but if you have to deal with life-threatening diseases, the problem is, of course, that you want to take more risks than when it's just a timely question. So why do the governments not respond to that question of the patients? Yeah, it's the costs, of course, at the moment. And I must say, in oncology, there is a problem at the moment. But patients are willing to face that problem, also the problem of the costs. But then we must be included in the discussion. What we now see, we have to wait till a black box commission comes with an outcome, and then we have to accept that, and that's not what we want.